Alrighty, guys, 4:30 on the drive home. Wayne, Tanya, and Brian all alongside. We have some guests in the studio as well. Our friends from St. Anthony Hospital here.
Yes.
Hey. Hello.
In an interview that Tanya is going to conduct solely.
What?
I said that I would just love for you two to ask them questions because we're going to be talking about pelvic floor or pelvic therapy.
Well, we only have one engineer on the drive home, and that's Brian. So if there's a doctor of the pelvis, it's Brian.
Yeah. But we have oh my.
I don't even know where that connection comes from.
Can I see? Is your face red yet? Because I can't see you from where I'm sitting.
That's
Brian.
all right.
We have Jessica and Leah.
Very good.
With HSHS St. Anthony's. And we're going to be talking about a little bit of pelvic floor therapy.
And we're going to need a lot of explanation on this.
I have no idea what this means.
I think most people are in the same boat. Wouldn't you guys say
Sleep
that?
on the floor, which puts my pelvis on the floor, but I don't think that's what we're talking about. So
there's a lot with pelvic floor therapy. So pelvic floor physical therapy is a very specialized form of physical therapy.
Mm-hmm.
So like Leah and myself were the only physical therapists in Effingham County that offer this service.
Wow.
And that's at HSHS St. Anthony. So what we both have our physical therapy license, but then we've done a lot of additional training so we can specialize in pelvic floor rehabilitation. We see a variety of diagnoses. So
some of the diagnoses that we typically see are for urinary incontinence, fecal incontinence. We also see urinary frequency and urgency, urinary retention, where it's difficult to empty the bladder, pain in the pelvic region, and we see also pelvic organ prolapse, where the organs tend to kind of drop through a different variety of reasons, as well as pre- and postpartum issues, scar tissue concerns, post-surgery, post-cancer patients. Certainly males, we see post-prostatectomy with incontinence in both sexual function, colorectal conditions, constipation, tailbone pain, and overall just muscle dysfunction. That's just to name a few.
Now, what causes, you mentioned the incontinence, what causes that?
So there can be many different reasons. It can be after childbirth, because that's kind of a trauma to the pelvic floor.
Mm-hmm.
Age, because as we get older, there's some weakness involved with that as well. Any other additional trauma, a severe illness can cause some leakage. So, right now we're in COVID-19 season. So with all the coughing and things like that, that can cause the pelvic floor to weaken and then cause incontinence. Pelvic pain, and hormonal changes as we get older. There's four different types of incontinence. So, and we see all four different types. There's urgency. So, it might be you're walking through the mall and, I got to go to the bathroom and I got to go to the bathroom right now. So then you're running to the bathroom. There's stress incontinence. So that would be the coughing, the sneezing, the laughing, lifting, or, if you have young children and you're trying to jump on the trampoline with them and you can't do that without peeing your pants. That's the stress incontinence. Mixed is kind of a mixture of the urge and stress incontinence. And then overflow would be, if it's been a little bit since you've gone to the bathroom and that bladder's full and the bathroom's 200 feet away, are you going to be able to make it there, or does it overflow and leak at that time? So,
is this something that's more predominant for women over men, or is it both?
That's a very good question. So there's actually, we looked this up before we came on today. There's 25 million Americans that have bladder issues, and 75 to 85% of them are women.
Wow.
So, yeah. And if you think about it, as far as urinary leakage, 1 out of every 4 women 18 years and older will have some sort of involuntary leaking. So it's definitely prevalent. It's just not something that everyone talks about.
Right.
And even if you have talked about it, there's a big misconception. A lot of times people will tell their doctor, I'm leaking, or they'll tell their best friend, I'm leaking, and they'll say, just squeeze, just do Kegels, and you'll be fine. And that's actually a huge misconception because it can actually make your leakage worse. If the pelvic floor muscles are very tight and you can't fully empty your bladder, then that can cause urinary retention, and then that can then cause more urinary leakage as well. So that's really what we do with pelvic floor physical therapy is we find out why you're having the leakage and then what you need to do or what we can help you do to fix that.
This is an uncomfortable subject, obviously, for a lot of people,
Yeah.
and literally and figuratively. But I mean, is it a situation where you get people that come in that this has been going on for some time and they've just kind of kept it quiet, that we're embarrassed by it?
Oh, yeah.
Yeah.
Absolutely.
Yes.
And, we may be the first people that they tell most of their life story to. They may have just told their friend or their doctor that, I'm having a little leakage, but really it could go back to when they were younger. They could have had leakage they could have wet the bed when they were little, and then they had leakage when they would play sports or when they would do gymnastics, and it just went from there. So we hear that a lot, that it's a long-standing issue, and then they, when they come to see us, they're just ready for some help and some relief.
What kind of help can you give them?
Yeah, so we do a lot. If when they come in, so they'll come in for like a 90-minute evaluation, and at that evaluation, we really look at the full body. We look at the posture, the core strength, the flexibility, and then we offer treatment based on what we find. So occasionally we will do an internal muscle assessment, and that gives us a good idea as to what treatment would be best for that individual. The pelvic floor is the only muscle group that doesn't cross a joint necessarily. So we can't really just see when you contract. That's why we do the internal muscular exam, because that'll tell us where you're weak and where we could strengthen or where you may need that stretching. And then, we also do what we call biofeedback. So, Leah, do you want to tell them a little bit about that?
Sure. So with the biofeedback, we can actually assess what the muscles are doing. So we put two little sensors up externally on the pelvic floor musculature, and they're sensors very much like little cardiac monitors. And so they pick up the action potential within the muscle, and it can tell us how much the muscle is contracting and how much it's able to relax. And that's very helpful because if someone's not able to fully relax, it's almost like you're taking a 10-pound weight and doing a bicep curl like at 25% of your range. So the muscles actually never get stronger. So when Jessica talked earlier about how if you do Kegels, it can actually make it worse, that gives us a good idea if that's actually happening. And it's a very individualized treatment, and so we can tailor it very specifically to what that individual's needs are with their pelvic floor, whether it be weakness or tightness or what we call muscle dyssynergia, where they try to tighten but they actually bear down. So there's all kinds of different things that go along with this particular assessment, and then that allows us to tailor an individualized treatment plan for the most success. And of course, we work a lot with their physicians as well that referred them, and there's different, courses of action that they take to along with us so we can have the most successful outcomes.
Yeah, and we do, I'd like to add that it is always one-on-one, and that's what is so great about this. You may not feel comfortable talking about it with your friends or even that much with your doctor, but we really get to know the patient, and we spend time with them, and we get to know their families and their lifestyle and how we can help them one-on-one to achieve their goals of less urinary leakage or less fecal leakage and incontinence.
Now, who should they contact? I mean, to either maybe schedule that consultation or just have questions.
Certainly. So we are located at the Richard E. Workman Center at 1301 North Maple Street, and they can actually call. It's 217-347-1243, or get an order from their primary care physician or a specialist that they're seeing, and they could fax us an order at 217-347-1558, and then the physician usually just sends their diagnosis or concern that they have along with the order for physical therapy to evaluate and treat for pelvic floor dysfunction.
And you guys have a lot of options on things you can treat with. Do you tend to see results results maybe starting after your first consultation, or does that maybe need some more work, or just depends for future appointments?
It really just depends. It kind of depends what is going on with the individual. For some people, we have to work on lengthening those muscles first before we can strengthen them. But it is not uncommon that after the initial evaluation that people will come in the next week and say, hey, I'm already starting to notice a difference. I can make it to the bathroom, or I'm not getting up 5 times a night. So some people get results right away. Usually we see people 1 to 2 times a week for 60 minutes. And usually within 6 weeks, they're able to say that there's a significant change in their incontinence.
Now, do they need to go through their primary physician in order to get things set up with you? Because I know you mentioned about their primary physician faxing over the orders or something like that. Do they need to go through them first?
Yes. It's
okay.
In order for coverage, insurance coverage, it's usually best to do that.
Okay.
They also we do get orders from like OBGYNs as well.
Correct. A lot of specialty physicians also send us orders from all over.
All over.
All right.
Very good.
It's good to have this service right here in town.
I had no idea.
Yeah.
And the fact that you guys are the only 2 in the county?
Yes, the only 2 in the county. And really
awesome.
From here to St. Louis, I think there's maybe 1 other facility that offers this. So, combined, Leah has some more experience than I do, but combined, we have over 20 years of experience doing this, and we absolutely love it.
We do.
Well, it's great that you guys are trying to bring this out of the shadows into the light, and shine some help for some people on this. So
a lot of people.
Thank you.
All right. Again, if they have questions and they want to get started, what should they do?
So you can call. If you have any questions, talk to myself, Jessica, or Leah. Our number is 217-347-1243. And we encourage you to talk to your primary care or your specialist as far as if you're having any issues, and we'd be happy to help.
Very good. All right. Jessica,
Thank
Leah
you.
with HSHS St. Anthony's Memorial Hospital, thanks so much for coming in.
Yeah,
Thank you.
For coming in.
Yeah,
Thank you.